Okay, so I just wanted to make a quick video. It's Friday, it's late, but just wrapping up on one of these designs, and I wanted to be able to kind of help people see some of the principles that are really important when it comes to designing an all-in-4 and making sure that you find a doctor that goes through the right steps to make sure that you have a device that's going to last. Okay, so this is, I'll just show you really quickly. I'm not gonna take a long time here, but this is a case of one of my favorites. If she's watching, she says she watched all my YouTube videos, but she came in today from California and met with her, and this is the design of her teeth. We tried this in today, and I'm just basically making sure we get this milling tonight so that we can make sure we deliver her final bridge here soon. So, okay, but here's the point I want to make. One of the biggest complications that we face, not it actually is the number one complication. So when people ask what's the biggest problem you have with all-on-4, the biggest complication is really patients being able to clean it, and it either is that the patients don't have the desire to clean it, which is a problem, or the patients don't know how to clean it, or the third option, or the third reason they struggle is because the device wasn't made for hygiene, meaning that it was made too bulky, and it wasn't made with hygiene as a big important factor. And so I just wanted to walk you through. So like with this device here, so these are these are teeth. These are the implants are here. And so what's really important is that this right here is the tissue. And so you'll notice that our bridge comes right up against and touches the tissue, okay? And so if you look all the way through here, we have a nice, good contact so that there's no space between there. So that way she won't get food caught in there, okay? Same thing on the bottom. But when we look at where the implants are, this is key. The implants still have a place where you can get in with a water pick or floss and be able to clean in between there. And so what I mean by this is, like, if I come over here, especially on the bottom, so on the bottom she had a little more bone loss, and so the top of the implant, let me take away the soft tissue here. Okay, so if you look here, this is what every device should have. If the implants are placed in the tissue, this is the bottom of the tissue and this is where the implant is, so that means that the top of the platform, the implant is here. Well, if a patient's trying to clean, and if you cover this up with the device, the patient can't clean. So you have to be able to make it, so again, this is the implant, this is the bridge, this would be the tissue. And so if we look at the tissue, we have to make sure that we create a place where you can clean around the most important aspect, which is right where the top of the implants. And so you'll see little access points here. See access point here. And then on the bottom, this is lines the tissue perfectly. So everything here is lined so that the patient is touching. That means she's not going to get food caught inside there. And so, again, one of the biggest things I get back, and this is why I've had to do a lot of my designs, is because a lot of great designers out there still just don't see things from a perspective that from a hygiene perspective. And if doctors aren't looking, this is a really big problem. I can't tell you how many designs I've gotten back from so-called, one of the best designers out there, and they have not created a bridge where it's easy for the patient to clean. So again, if we look at overall how the bite comes together, these are, if we look, so there's a little bit of space here. This is important too, because if I tilt these teeth way forward, it's going to push that lip out. And so the patient understands that, and but sometimes doctors make the mistake of closing this gap up to the point where it pushes that lower lip out quite a bit. So that's one thing you have to be careful too. Let me show you one last thing. Again, let's show you here. Patient. So if the doctor's not taking lots of pictures in the design phase, then that's a problem. So this is the wax up of her final teeth. But if I was to go here and take out the wax up, we'd see this, and that right there is her temporaries, but they're not the temporaries. We actually added wax along here to create the right facial profile. And so once we went from temporaries into finals, we wanted to create more lip support. And so we added this wax in there just to build it up so we could take a picture. And so this picture is built with this wax support to be able to push her lips out. And then we were able to follow that outline. So if I take the picture out, you'll kind of get an idea of what I'm talking about here. And I bring back in. That's the cool part about all this, is that you can really be methodical. So this is what we had, and this is what we had when she came in for her final calculations. But obviously these aren't the teeth that she wore. The teeth she wore were behind here, and we decided that she needed more lip support. And so when we went to design it, we took the pictures with this in, so it pushed the lips out, the facial profile out, so I could give her the right profile. Then I took a picture, and then when we started designing, I used that as my inspiration as far as coming up with this design. And so you'll see, like, I used a lot of the contours of it. I brought the teeth down just a little bit to be able to give her even a better. But you know, this is what's really great about digital dentistry. But a lot of doctors don't take advantages or just lets their lab do that. And I don't know if labs. Well, I know this. Labs don't take a lot of time in designing these. Most of the time, they don't even have a picture in front of them. And so, but what I really like is this view here. This gives you an idea of, this is what was in her mouth when we took the final calculations, and this is where we took this picture, right? If we go back here, here's the picture. So I can toggle in and out of here, and the cool thing is that when if I take the picture out, now I can see these are the changes that I made to the teeth. And that's pretty awesome. So then I can see, okay, I dropped the incisal edge just a little bit because I noticed when she was talking that she wasn't showing much teeth. When she smiled, it was pretty good. And that's what can be deceptive, is what, you know, we take videos like right here. This is the video that I took at surgery. Let's see here. Oh, I hope will it play for me? Come on. It was going to play. I don't know where it went. Let me see if I can find it real quick, because this is a key component to why I think we go above and beyond. Let's see here. Let's see if I have that video. I think the video would be good to kind of show you. Here we go. All right, so Elizabeth was on. We're going to do a redesign. Okay, bite down for me and smile big. What you're looking at looks strange, but this is basically, think it's like a wax room. We added to her existing pre-op teeth, giving her more lip support in the posterior and in the anterior. And so we want you to treat that like a wax room. Okay, so at first let's talk, what's the most important things you want this technician to remember when he designs his teeth?
I wanted more lip support and a more...
So notice the thing is, when she's talking, she's not, you don't see the incisal edge, okay? Even though in the picture that I've been showing you, she shows it. And so that's one of the reasons why I dropped the incisal edge.
A bit wider and just not such a long of a tooth. It was like a teepee kind of. I want more of a wider tooth, lip support, and fill my mouth.
Perfect.
Yeah.
And what about the lower?
The same thing. The lower's pretty darn good.
Awesome. So I think what she's saying is that in her initial teeth, right now we have a lot of red there, so you may not understand exactly what she's saying, but we want to basically have square teeth.
Yes.
Okay?
Yes.
And when she smiles, we don't want to have a gummy smile. Go ahead and give me a big smile so you can see right where it needs to be. Okay. All right. And while you're right there, I'm going to point. So smile, big cat. So you're looking at about a tooth. So I like the width as far how far it goes up. Again, so that video continues on, but the reason I showed that is in order to land in the right spot, we did the try-in today, and the try-in looked fantastic. We made a couple of modifications. She didn't want real pointy canines. There were some small things that we tweaked. One of the central incisors were just just tiny bit longer, but we made these tweaks, and then we were able to show it to her husband, and then and now she's going to be going into her final. And so, after all is said and done, this is the reason why you can't rush. You can't rush doctors to go so fast and stuff, because if you do it the right way, I think this is a really beautiful design, and most importantly, even though it looks beautiful, it's super hygienic, meaning it's going to be easy for her to take care of and clean, and that's what's going to serve her for the next 2, 3, 4 decades, I hope. And so I think that's everything I wanted to kind of show you. But maybe one little other thing I'll point out too is, she has 5 on the top, she has 5 on the bottom. All on 4 is just a concept. The concept is that when we build teeth, it's going to be all, meaning teeth and gums, all on whatever amount of implants. So 4, 5, 6, 7. So teeth and gums is the all on part, and then whatever how many implants. Versus something like a 3 on 6 where you have 3 separate bridges supported by 6 implants, 3 separate units, So you'd have 1 implant here with a bridge, and then you'd have a bridge in the front, and then you'd have a bridge over here. So anyways, I think these devices are super, super strong. We're going to be milling this into zirconia. Look how beautiful it is. It's really nice, and I'm not 100% done. I still make some tweaks, but at the end of the day, this is a really great a way of approaching these types of designs. And again, the doctor often is never part of this, and they just get back designs and they can't change them. They rarely, oftentimes they don't even look at them. How do I know this? Because before I really committed to all this, I had to struggle with this, and it's hard when you're just basically writing a script for a lab technician to follow. And so anyways, I hope that serves you guys as you guys are thinking about all on 4. Let me see if there's any questions here. Okay, so far looks great. Wow, that's amazing so much. Thank you so much, Shannon. I appreciate it. We are located in Salt Lake City, Utah. But yeah, so if you guys have any other questions, leave your comments in the comments below. I'm trying to show a lot more stuff. My goal is to put out twice as much content this year than I have in the past 5 or 6 years. So subscribe to the channel so you can kind of continue to get the updates when they come out there. So you might be a doctor out there that's watching me. Hopefully we'll start teaching again in the near future once all this craziness passes. But you can learn a lot of the stuff as I just teach my patients or potential patients. So at the end of the day, I hope that was good for you guys. Hey, have a great weekend. We'll see you.